right. Hello, everybody. This is Tom Randall from Goldencare. I want to welcome you to our webinar today. Where we're going to talk about our home healthcare only plans as part of our short-term care initiative through Integrity. And I tell you what, it's my pleasure today to be on again with Dennis. Dennis has been in this business for a long time, as have I, and I think I'm my 27th year here at Goldencare, and I think I've had the pleasure and privilege of working beside Dennis throughout almost all of those years, if not all of them. So you guys are in for a treat here as we go through some of this training. Today is going to be on the home healthcare plan side of it to give you kind of an introduction to the home healthcare plans we have available and when they'll pop in. But Dennis, one of the fun parts about this, we've done about 30 webinars. We're right in the middle of it here, of doing 30 live webinars in a 25 business day period. So we're excited to bring it to you. And Dennis has so much sales experience and it just brings a wealth of knowledge because he's had the opportunity to train probably 100,000 agents over the years. And Dennis and I both had the opportunity not only to train agents, but to go out and do live webinars, or excuse me, I always say webinars these days, live seminars in front of clients and to educate them about the need for long-term care. So written over $1 billion long-term care in the years, and now we're moving into the short-term care these last many years, I guess you'd say now, and realizing that right now this market is probably poised more than ever for the short-term care. So Dennis, go ahead and say hi, and I'll let you kind of start it out here if you'd like.
Yeah, you bet. Thanks, everyone. Thanks for joining us, and thanks, Tom. Yeah, Tom and I have had some great times on the road together, as well as working remote. And so, Tom is equally as talented in his skill sets, even more so when it comes to some of his abilities when it comes to plan design of actual products that we've been very instrumental in being part of. And Tom's had his fingerprints on a lot of that over the years. And so, as we talk about this, and this is, I think Tom's mixing it up today because he's probably tired of the fact of always saying that I'm getting tired of these statistics. When we talk about incident rates, and we're talking about these numbers, they really don't change. I mean, there's lots of different statistics all over the place, and you never want to hang your hat on just stats alone. But the reality is, most of your clients are going to experience a situation, as the number shows here, that 70% will need some type of care. It could be for less than 6 months. It could be, they get full-blown Alzheimer's and need, care that can last as long as 10 years. And really, one of them will be impacted almost certainly 90% of married couples. And so the challenge is this is a very underserved market. 90% of these individuals have never really had a discussion about the importance of planning ahead, whether it's home care only, long-term care, short-term care. And during COVID, boy, it really had an impact. We all know the horror stories and everything that happened as far as those that were trapped in those facilities and not being able to see their loved ones, and that's why this number is not really. It seems very high, but it doesn't surprise me that 61% of people surveyed said they'd rather die than go into a nursing home. So in the shifting market, we've talked about this on previous webinars, and some of you who've been in the business a long time, and like Tom and I, who have seen kind of the go-go years in this care space, where we were writing really to individuals who were in that upper age marketplace. But what's happened with the evolution of these short-term care products is there's been a paradigm shift that agents and consumers are really aligned with the same mission, which is they've said this loud and clear. And finally, and we saw this coming, and that's why we were very instrumental in trying to design products in this particular space. But they said loud and clear that they want to have solutions today that really have less underwriting, because the reality is those earlier years in the long-term care space, we were placing a high level of percentage of those individuals, but today, not so much. And so today, when we talk about these home care products, we're really talking about, even though there's younger age availability, we're really talking about your senior clientele. So again, products that have less underwriting, products that have they're less complicated to explain, and literally products that are so affordable that these home care products, they spread the net wide, and they are very, very affordable. And the reality is, this statistic is why these products are so important, because 80% of mature Americans 65 plus have at least one chronic condition. They've either been underwritten out of those other solutions, or they've been priced out of them, or a combination of both. And so as Tom walks us through and really gives you a better understanding about how these products work, and kind of compares and contrasts a couple thoughts here relative to short-term care versus standalone home health care. I'll turn it back over to you, Tom, and let you go ahead and thanks for letting me have the shot at the stats today.
You like that? It's Friday. I had to throw a curveball. Thanks, Dennis. And for those agents who've been on with our other webinars, you've heard us say quite often, not only that we have the passion for this, there's a lot of gray hair in America, and we need people to offer solutions. So that's why, to me, that slide is really important at the beginning, to talk about the fact that, everything we do for a reason. And one of the things that we need to do is, as agents, whether you're selling Medicare, life, or annuities, or anything else, final expense, we realize that the need is still out there, and we have to start. And Dennis and I have some great webinars on sales to teach you how easy it is. And maybe some of you have been on those already during this last month, but we really have some good ways to show you how easy it is to go out and start that conversation. And today we're going to talk about offering the products. And you'll hear us say quite often when we're in our training that the biggest ability of a lot of these plans are their availability, right? So we're going to talk about underwriting and what states they're in. And that's kind of the first step that you're going to take as you start a conversation with your clients. Because like Dennis said, a lot of the older folks that you're sitting in front of, especially a lot of the people on the call are probably Medicare agents. A lot of the folks you're going to be sitting in front of will have some health conditions. And we're going to show you before today's over, this little webinar, we'll show you the site and show you all the tools we have to make this real easy to find out about the underwriting. But for some of you who are fairly new to this arena, in the short-term care or extended care market, there's really two types of products. The first one are these home health care only plans that we're going to talk about today. And we've got several options in our Integrity portfolio. And with these plans, you're going to see and be hopefully pleasantly surprised. Just about anybody you're talking to, whatever you're selling, you're going to find out that just about everybody can get a plan with these home health care only plans, because there's literally just a couple or a few underwriting questions. And because of that, obviously, there's a little bit more limited benefits, and it's home health care only, no facility. So there's less risk for the carrier. So that's why these plans are so great and so valuable and so important to have as part of your portfolio, because of that, throwing the net wide on the underwriting side of it. Then on the other side of it, we have full-blown short-term care plans in our Integrity portfolio. And those are the ones that we want to make sure you have the opportunity to go out and offer people if they can get through the more comprehensive underwriting. So you're going to see we have 6 main products that we offer in the short-term care Integrity portfolio, and you might have other plans as well, but these are the ones to keep it simple in case you're not deep into up to your neck in the trenches of going out and offering extended care. We want to make it easy for you, and that's one of the stressing things that we talk about in our sales webinars and our product webinars. You don't have to go to med school, you guys, and you don't have to go and learn and take a doctorate degree in learning how these plans are put together, because we found plans that are relatively simple. It's not like long-term care. If you've ever thought about getting into the long-term care industry and decided not to, they're confusing, aren't there? There's a lot of moving parts, a lot of different things that you have to be aware of, and extra certifications. With these plans, they're simple, they're easy, and they're something that you don't have to take your blinders off. You can go and do the same thing you do every day. Go out there, talk to your people, sell your products. That's your main focus. And then just start the extra conversation and add on a very, very important extension to their medical plans that they have. So Dennis, I can turn it over to you if you want to quick do the state things, but I did put home health care, and then I think I have the short-term care on the next slide.
Oh, excellent. Yeah, thanks, Tom. Again, these plans are not the perfect panacea. There's going to be a shortfall because a lot of states have problems with the language of these home health care products or even short-term care products. And so as we look at the GTL, pretty good coverage, in the mid-30s as far as state availability. You can see it there in the blue. And And then Manhattan, that product is very much similar to the GTL. GTL was the leader that came out with the first short-term home health care, and now there's been some other carriers that have kind of, in essence, decided that they were going to jump in and put their twist on the products. And so Manhattan has a legacy product that's their previous version that you can see those states: Colorado, Hawaii, Kansas, Kentucky, Illinois, Indiana, Maryland, Ohio, Pennsylvania, and Tennessee. And those states will eventually become part of the Home Healthcare Select. But right now, they're not. It's still the previous version. And the Home Healthcare Select states, you can see that there. Tom mentioned that we need to service all these different Americans, and we know some of you on this call might be in states where you say, how come you never have anything for me? I'm in Florida or I'm in California. And some of it, as you know, is just out of our control. And even where Tom is in Minnesota, Minnesota is not friendly to some of the short-term care or even standalone home health care products. So we have a product that we did a webinar on the other day that is a non-insurance product. It's a service contract, but they've been around 16 plus years, and it's available in all 50 states. And so you see that referenced in kind of that blue, that lighter blue. And then you can see where all three carrier products are available, and all three, including the Manhattan's previous home healthcare version.
Yep. And Dennis, thanks. And those were the home health care. And, I thought I was being really smart by putting that slide first because we're in the home health care only arena. I probably should have swapped these over because this is our short-term care. These are the full-blown plans I talked about that the underwriting is a little more strict, but we have some good flexibility there. And one of the things you'll hear in our sales training as we start the conversation and move into designing plans, we talk a lot about you want to offer the most coverage you can for that client if possible. And we even get into advanced stuff if you want to, where you can sell two plans, a short-term care along with a home care, et cetera. But this slide shows the short-term care availability, and you don't worry about now taking notes or doing anything weird with your phone, because we do have this on the site that I'll show you that we'll have these maps on there and stuff so you can quickly see. And we have another underwriting tool that will show you that it has the ability to real quickly see with whatever client you're talking to, which plans are available and even what the underwriting criteria is. So you'll be able to select the best plan possibly. Hopefully, most of you will be selling short-term care to a lot of your clients, the full-blown plans that offer a little bit more robust coverage. And if you can't do that, then the home health care is a great option. And sometimes for affordability, of course, too. But we get more into that in the sales side of it. So if you want to, Dennis, I can probably take this one too. This is just a side-by-side for you for future reference. Should I go ahead?
Yeah, Tom, I think it's because we're spotlighting just the two that are the insurance-based products. I know we're going to come back and maybe speak just a little bit high level on the True Freedom, but yeah, there's similarities, but there is differences, and so why don't you go ahead and give us that overview?
You bet. And you jump in anytime. Dennis and I have done a lot of these webinars lately. So number one, with the sound difference, we're in different locations, different states. So if I'm blaring your ears out and Dennis is quiet or vice versa, we apologize about that. But I do want you to know, Dennis, he'll jump in if he feels the need for any of these spots, even though I get rolling sometimes. But the big thing Dennis and I will teach you as we go through all this training and you get a little deeper into short-term care is the one thing you have to realize is that it doesn't matter as much what kind of plan you offer people. They all do a great service for them, okay? So as we go through this, they all have their niches and highlights, and we get into that deeper in the individual product training. But I do want you to know a lot of similarities. That's why I put this on one slide here. If you're looking at GTL's home healthcare plan and Manhattan Life's home healthcare select, you can see that it's 61 to 85 and Manhattan goes 45 all the way up to 89. So a little bit difference there. And again, this will be on some of those tools that we have available for you. So you'll be able to see that real quickly right in front of you if you'd like to be looking at all the plan options at once, okay? And both of them are really similar. You're going to see tons of similarities as I put these side by side. They have a plan A, B, and C for GTL, and Manhattan has an ABC, but they call it Classic, Premier, and Deluxe, okay? And what these are is they're called design benefit plans. So if I choose plan A or the classic plan, it pays up to $150 total benefit based on different services that I'm going to show you in a second here. Plan B, 300, plan C, 450. So you can say they're identical as far as the maximum daily benefit that they pay out. Okay, so skilled nursing, you can see there, that pays out at 75, 150, or 200, identical for the two. If you have a general nurse come in, it's going to be a little bit less for GTL, but Manhattan just lops them together saying any nursing at 75. So there's one of those subtle differences that aren't going to be deal killers in either case, but they are a little bit different. And then as you see these come on your screen, I'm not going to read every one and every benefit for you, but these are all clearly laid out in the brochure, and they're all clearly put together so you can see what they offer for the different benefits. So you can see here, if somebody had a nurse come in and then needed medical social services or respirational therapy or whatever on the same day, then they would pay both of those up to those maximums on the top there, the maximum combined daily benefits. So as long as you understand how simple that is, easy stuff with this. They also have a home health aide benefit of 60 days. So the one thing that's different with this, and on the brochures, you'll see the GTLs play for 360 days. Manhattan Life's a little different. They go to 365, right, Dennis? I want to make sure I'm not misspeaking there.
That's correct, Tom. That was part of the enhancement with that select plan.
Yeah, so just a couple extra days, not, again, a deal killer one way or the other, but it's a little bit extra bang for the buck on the Manhattan side. And then the home healthcare aid benefits, you can see they're identical there as well. Home healthcare aids, we know, are the most common benefits that you use at home. So they do have limited benefits there. And why do they do that? Because they have such broad underwriting that they know they have to protect the carrier. So these plans are significant for years and years to come. So that's the one thing you'll see with the short-term care, full-blown comprehensive plans. Those have home health aid benefits paid on an indemnity basis as well, but they pay them for the full period of care that you buy. So that's why, if you can get through underwriting, we usually say if it's affordable, get them the better plan with the short-term care. But with the home health care only plans, they're really nice options for people with affordability issues or for people that can't get through the underwriting, of course. Okay. Prescription drug benefit, these are huge. These are huge. There's the average 65-year-old in America takes 27.3 prescriptions or refills a year or so. These prescription drug benefits are really just ways to reduce the net premium that you pay, because most folks that buy these policies end up where they do have a shoebox full of meds. So the way they pay out is very similar with these plans. It's $10 for generic brands or $25 for the prescriptions that are brand name. And basically every time they get a refill, they don't have to be on claim or anything. As soon as you sell them a policy, they can get that prescription drug reimbursement. And tell you what, it's really nice because of the fact that $300 off that plan A, a lot of people will use that full $300. You're going to be surprised pleasantly on how many people use up that. And if you can see there, a little bit of difference. Plan C for GTL has $900 for the people who have just a ton of meds and refills. They might be pushing on that $900. A little bit more robust than Manhattan Life, $600 at this point. But again, not really a deal killer, just a little difference in the plans. Dennis, I don't know if you want to add anything to that, or you can go ahead.
Well, Tom, I think the key with a prescription drug is it becomes what I call a premium justifier. You know, if they're looking at that, you might mitigate on that example that you used with the plan A, where you might mitigate the entire premium. Even though these rates are age banded in 5-year increments, both products have that same exact design. But it's surprising how people can really save dramatically, and it becomes almost a situation like, why wouldn't you take out this plan? And back to your earlier comment about the combo approach, there are some definite strategies, and that's maybe for another session. But no, very very good, very similar, and both are great companies, and both are great plans.
Absolutely. And the nice thing about it, again, one of the biggest abilities is what? The availability, right? So we know that we have to check the states to make sure they're there. And secondly, we've got to check that underwriting. And this is what we talked about. I'll put GTL first, then I'll show you Manhattan. This is actually right off the application. And when I tell you that you're going to have the opportunity to pretty much get coverage for everybody that you're sitting in front of, just about, this is what I'm talking about. Look at this GTL, short-term home health care underwriting. With this one, that plan we just showed you, there's literally 2 knockouts in most cases and sometimes 3. And you can see there it says, is the applicant currently in a nursing home, assisted living, or receiving home care or similar benefits right now? You know what? If they answer yes to that, it's a knockout. If they answer no, they're fine. Second one, is the applicant unable to perform those activities of daily living we always talk about, bathing, dressing, etc., or are they cognitively impaired? So you can see there that those are very simple, that you're not going to have many knockouts. Option C down there is only if you sell the most robust plan, and that just goes a little bit extra. It's not really a smoking gun by any stretch. It says in the next 60 days, do you expect to have to go into a hospital or have a surgery or go into a facility or require home health care? So you can see there, even with GTL, which, believe it or not, of the 3 products we're talking about today, is the most tough underwriting. So the short-term care plans are going to be a step above this, where it's going to be a few extra questions about health conditions. But this is very simple with these home health care only plans to be able to get something in place. And I promise you, I've done this a long time, as has Dennis. If you realize how much people will love you for these plans, even though there's a little bit of limited benefits, if they can't get anything else, there's people looking at you saying you're a lifesaver. So there's some really good possibilities with these home health care plans. So the next one you look at is the Manhattan Life. This is a shot that I just took out of the application as well. And with the Manhattan product, there's literally 2 questions as a knockout with this home healthcare select product. And it's, are you currently living in a nursing home, assisted, sound familiar, or currently receiving home care or similar benefits? If you answer yes, it's a knockout. And the next one is your ADLs, or activities of daily living. So you can see there, that's throwing the net wide, isn't it? That's about as broad as you can get. And that's the nice thing about these products, is that if you have to do it, you have the ability to go out there and get some coverage for your folks. So Dennis, I'm going to turn it back over to you to talk about our other plan that's a little bit unique, but it's just a lifesaver for the fact that we talked about it's in all 50 states, where a lot of these other plans, there's a few states that just say we're not going to allow those type of plans in. This is a great opportunity for those clients, so you can offer some protection for them for sure. Dennis?
Yeah, you bet. And you know, one final point that Tom that we like to stress on those on the GTL and the Manhattan is, remember, no phone interview, no asking for medical records, no MIB. These are really jet issue plans. You know, the short-term care, what we like to call extended care, they get issued, you know, typically 2, 3, 4 days. These are usually issued within a day, because again, the underwriting, as Tom said, is cast wide. And remember, there's no coordination of benefits. So even if someone says, well, hey, Medicare might pay for that, well, it doesn't really matter. You still get paid, because these are all indemnity-based plans, as Tom talked about. So the True Freedom is think of it like a AAA. It's a membership plan. They've been around 16 plus years. We're talking about non-medical home care services, and it is a product that we've done a special twist for all of our partner and for you who are agents of our partners within the Integrity family. And we've added a base plan that goes all the way down to 600 hours that complements a lot of what you do in the Medicare space, where maybe you've got some budget sensitivity. And that is actually $39 a month before discounts. And you can see the bronze plan, the silver, the gold, and the platinum. And we equate those because they are prepaid hours as to what a lifetime retail value would be. So still, just like the standalone home healthcare plans, there's still some very good leverage. And what you may need True Freedom for is because, again, you may be in states where we just don't have the coverage, or you could be backfilling where someone just wants again, a home care only solution. And so all the top home care companies, Visiting Angels, Comfort Keepers, Synergy, they're the 3rd largest home care company in the industry. They are all available for your clients to get service in what they call agency hours. And there's also another component. I don't know if we get into that, Tom, and that there's an anytime hours where it can be 24/7. It can't be a family member, but they actually can get services from a friend or neighbor. So again, this is it's just, we're in the, I like to always tell agents, and Tom does as well when we're on these calls, that, not only do we have the passion that Tom referred to, but we recognize that we're in the problem solving business, and we have to be able to go in and help clients to plan ahead, to be prepared. And it doesn't matter what state they're in. It's not their fault that they live in California or live in Florida, or a state where maybe there isn't the availability of some of the other solutions. So we want to make sure there's a solution that's there, and this happens to be one of them. There's other strategies that are available too. I'm not trying to say this is the be all end all, but again, the reality is care costs are very expensive. And when your client has to react to this problem because they didn't plan ahead, and I want to come back to what Tom said just a moment ago about, when we cast the net wide, and people who have a shoebox full of medications. Remember, these products are great referable products. And what I mean by that is, when you help a client, and that's part of this starting the conversation that we like to talk about, but when you help a client who really couldn't get anything else, guess what? They know other friends just like them, and they will gladly tell a friend about something they got, especially given the fact that the friend might say, yeah, well, your health wasn't the best, and you're able to get that. And so again, these products do fill a very important role for you to have in your menu or your lineup. And so, Tom, we may want to talk about. I mean, we're not going to maybe get into all of these, because I know we want to go to the site, but I know you like to focus on, as do I, about why do they need to have the conversation. And and we just did that, I think, a full-blown webinar. Was that yesterday? All these days run together, and I'm trying to think, but I think it was yesterday that we had that, and where we talked about, again, how important it is to have solutions that will pick up where Medicare leaves off. And so you may want to add to that, and then I know we want to go a little bit further, and then take them into the site.
You bet. And again, we don't want to turn this into the full sales cycle, but I'll tell you, I always put these slides on here. I think the next one actually shows a little bit more about some of the reminders that we go into on some of our other webinars on the sales side of it. Because the one thing we want to make sure you guys understand is if you're selling Medicare or final expense or some other product right now, and that's what you do day in and day out, even if you're not a wily veteran and you're just dipping your foot in the water here of this new extended care thing, and kind of thinking, maybe I will take that leap. I tell you, it's really important you do, because one of the things is you have a huge head start over a lot of our agents. And I see a couple names on here of the attendees of people who have been with us in the long-term care arena for a while. And remember, with long-term care agents, a lot of times you're getting lead cards, and you're going out and making cold calls and trying to find out from the beginning if they're in a wheelchair or not, or find out if they have any need for this, if they're just checking things out. The nice part for you is that you've already built a rapport. And when we talk about sales, you got to have that break in the ice period and that little bit of buildup. And that's something that we cover on another call, but you have it made because of the fact that a lot of you have a little bit of, sometimes a lot of it, of experience with your client already. You've got that rapport and that trust already. And literally, it's that easy that I'll spill the beans a little bit on the sales deal, is that, it starts as simple as, hey, I've done what I do every day. I'm closing the sale now. I'm finishing up my appointment. And I say, oh, by the way, before I let you go, want to make sure you have your extended care taken care of. It literally can be that easy. And we always talk about Dennis had turned somebody around in 5 minutes over breakfast and sold them a plan practically, because it's that easy to start the conversation, especially if you've already initiated a plan with them. And like Dennis said, when he asked me, why do you do it? Not only do we have all the gray hair in America who really need your help, 90% of the people have never had a conversation about it. So it's really important, just on the side, like Zig Ziglar says, the more people you help, the better off you're going to end up at the end of the day. I really believe in that. And remember, we know that we have the tools we're going to show you in a second to do this easier than you may think. And if you do it, not only are you helping folks, but I'll tell you what, You have great persistency. You're going to have your client retention go way up. We all know those stats out there. The more products you have, you're going to build even more trust with that client, because they're going to look at you like, wow, not just a Medicare salesperson. This is somebody I can look at to help me in my health side of it, and a continuation of my health care. So there's a lot of pluses with this. And we know it's not a hobby. Truthfully, this is one of those things. These products have really nice commissions with them too, and overrides if you're an agency. So they're really nice extra money for you to be able to go out and help people and get rewarded for it that way. So I could go deeper and deeper in that, Dennis, because I know I'm passionate about the fact that if you turn this corner in the Medicare, the only good thing that came with COVID, you guys, is people started realizing, you know what? I don't really want to go in a facility. Maybe it's pretty smart to listen to somebody and show me how I can protect myself and stay out of that nursing home or facility as long as possible. So, Dennis, I'll turn it back over to you, and I'll start pulling up the site if you want to just add to that.
Sure. Yeah. I mean, bundling, packaging, cross-selling, stacking, it doesn't matter what term that you want to use. The reality is, Tom said, the persistency, the money becomes a byproduct of the service. If you focus on helping your clients, and again, I really think, as it relates to products, that these products are just great referable products, because not only will your client be happy, again, especially if they feel like they could not get coverage. The products are so easy. They're so easy. They really sell themselves and it doesn't, again, matter what Medicare pays or doesn't pay. The reality is these products are all indemnity. Remember, again, and so the site that Tom's taken us to is a site that we built for you to be able to have a one-stop shop, so that you don't have to worry about, oh, gee, where's that Manhattan brochure, or where's that GTL brochure, or hey, what was that about that True Freedom? You have everything. And so, Tom, I'll let you kind of just take them from the high level overview, and they can certainly go and spend time and be able to see everything for themselves.
You bet. You bet. We just did a webinar yesterday, and if I don't want my day screwed up either, when you do 2 webinars a day, sometimes you start forgetting which day is which. But like Dennis said, we just did a webinar yesterday too that talked about some of this admin, and it went through this site in big detail, and we'll have a recording of that available for you on this site, where I'll show you in a second. But I'm going to jump to sales and marketing in a second. I'm not going to bore you to tears with this, because we have other training on it, and we don't want to take up too much of your time. But this is where you can get that InstaPivot tool and the sales and marketing area that I'm going to show you in a second. But before I do, each one of these 6 products that we have on here, and we'll add more as we need to or as they become available, but these are the Integrity portfolio products for the short-term care initiative. And you can see here's the comprehensive short-term care plans. We have Omniflex Manhattan Life's Plan, the Recover Cash from GTL, and Wellaby's Essential Care and Essential Care Plus. Those are the short-term care plans. And if you click on here, it'll give you everything you've ever wanted to know about those products. And it'll go through and give you sales materials, consumer materials, everything you can think of as far as a necessity. So again, for time's sake today, I don't think we need to jump over to each one, but I will tell you the home healthcare plan, same thing. Here's the Manhattan we talked about today, the Home Healthcare Select, GTL's Home Care, and True Freedom. We have all the information you need just with a click of the button, so you can feel prepared ahead of time to learn it, or at the time that you need it. Okay. If you go to the sales and marketing area, the first thing you're going to see is an InstaPivot link. And if you click the InstaPivot link, it does require a sign in, but it's real simple. It's not like you have to fill out a big form. It's just an area that this is a proprietary product for Integrity. And we want to make sure that we know who's going on there, because it's very, very strong. What this does, and again, I'm not going to go into training because we have recorded training on this, but basically here's our products. If you can read it, there's True Freedom, there's Manhattan Home Care, GTL Home Care. Here's the Manhattan Short-Term Care, the Omniflex, the Wellaby, and the GTL. So same products you just saw, right? What happens here is on the left-hand side, we've got every single question that they ask on all of these different products on the application. So everything is there that you need, and you can go right up here. You can select different products if you wanted to. And the nice part about this, if I were to click a state, I could put in a certain state and it would turn green to show me. It might be sleeping now because I've had this open for a while. I'll try it though. sometimes. There you go. It was fast. There's True Freedom, Alabama. You can see it's available everything except Wellaby's not quite available in Alabama yet. This is a living, breathing tool that when it becomes available, this will turn green as well. Then we have over here all these conditions, but you don't have to scroll down and read them all. All you do is go up here, type in a condition, and it'll segment off just that row. And that way you can see which products will take it and which ones won't. And we've got over 1,000 medications in our medication list, and you can have multiple health conditions and multiple medications, and it'll show you which products are available at a quick glance. So if you're planning ahead and you want to use this, great. Some agents we do in our sales training or designing a plan training, we talk about the fact you don't need to use this tool. This might be something you say, I don't need to dive in that deep. I'm just going to look at an application and know which product I'm going to go with that way. So more power to you. The key we want to do is help Americans and help you close more sales. So Dennis, I don't know if you want to add anything else to this quick little overview of the InstaPivot or not.
Yeah, no, it's a great tool, and really hats off to Tom. Tom actually developed this originally on Excel spreadsheet when he was researching exactly the underwriting and all the extended care products, and then our IT team got together and took it to the next level. And this is kind of the day one. There'll be a day two version of this as well that will be coming, but it's in the standalone home healthcare market. Really, you don't need it as much because we already showed you how easy the underwriting is. But when you get into the extended care, it has just a little bit more, but it's not quite, as Tom said, as complex as long-term care. Back to Tom, when you were showing that, if you scroll down and you show the home care selection of those products again, back on the main site that we were just on, keep in mind that those consumer materials, we also have consumer facing, and on the GTL site, there's a consumer video. True Freedom has a consumer video. So those are all things that will help you. And again, whether you're teeing it up during the course of AEP, as we're upon AEP here very soon, and you want to come back, and just set an appointment, this is something that you can email that video out. You can, these are easy to have the conversation when you finish up with your Medicare. They're not hard products, actually. Again, quick enrollment because the underwriting is not difficult, and you probably already have all the other data on that client. And again, the way you can transact with these, with the e-apps, paper app, whatever way that you want to do business. And again, it's as close to jet issue as you're going to find.
Absolutely. And thanks, Dennis. And before we let you go here, guys, just going to really quick just tease you with the sales area of it. Dennis already said underneath the specific products, there might be specific product type sales information. But if you go to the sales area, this is just kind of in general, the extended care market. There's some stats there you'll see. And the sales and marketing material here, you can see there's a bunch of training videos here. We've got like 14 training videos up there. We've got the InstaPivot tool again, marketing assets for agent use. And again, all these you'll be able to see and have access to consumer asset pieces that you can use, and more training down here for you as an agent. So really some great things. And again, we have a full training on this that we go through and show you all of that we have a recorded session as well. So the nice thing about this is, remember, we're working closely with our partners. So if anything is on there that we need, or that agents tell partners, boy, it'd be nice to have this, we're going to add it to that living, breathing site like we talked about, because it is something that we think is really going to help you when you're out there helping other folks. So Dennis, with that, any closing thoughts here for you?
No, I just think it's, all of it is easy. It's really just getting outside of your comfort level and taking the time, and we know how laser focused you can be. But remember, if you're not that resource, for that client, we like to say, and this is maybe a familiar quote that some of you have heard before, but if not you, who? If not now, when? Someone's going to have that conversation with your client. And you know what? That stickiness of that relationship will be much stronger. And if it's you that is actually the resource versus opening the door for someone else to come in who may eventually affect your other core business that you have with that particular client. So it's a great opportunity. Not only are you doing a valuable service, but you're also, protecting your business and the referral opportunity. I just want to stress that again. People who are unhealthy know other unhealthy people. Not to say that healthy people don't know unhealthy people, but I'm just saying that, you know what, they tend to when they get something, they're kind of proud of it. And it's a little bit different than if you're out there selling annuities and you put them in a $300,000 annuity, they may not want to tell their friends about what they did financially. But when it comes to health, no problem. You'll find that you'll have some great referrals, and those referrals may open up the door that leads you back to your Medicare side as well. So keep in mind, all of it goes together, and at the end of the day, you're taking a more holistic approach versus just a product approach, and I think you'll benefit from it, and your clients will certainly benefit from it. And come claim time, as Tom said, they'll be happy that they made that decision. So Tom likes to say, the rest is up to you.
Yeah, absolutely. Thank you, Dennis. And great job. And you guys on the phone, before you hang up, I can't stress enough. The next step is up to you. Contact the marketer who got you on this webinar. And what we see all the time is there's agents like you saying, boy, I'm busy. Do I want to look at one more brochure? Do I want to learn one more little thing? I can't stress enough the easy button on this sucker, because once you do it, we see it all the time. Agents put off. And it's like, I thought that agent was going to write. And once they write one and they step out of that comfort zone just a tiny bit and figure out that, wow, that was pretty easy. That site was easy to work. It was very intuitive. I clicked a couple buttons. I got my client some help. And then all of a sudden you see bing, 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 a bunch of other apps start popping in, because once you realize how easy it is, you'll probably be pleasantly surprised at not only how easy it is to start the conversation, but how easy it is to lock in some coverage and help your clients. So that being said,
go ahead, Tom, I'm sorry, I didn't mean to step over you, but I was just going to say, you brought up something that I just wanted to make mention of, and we've talked about this in previous calls. We have a call center relationship, and not only on the extended care, but on the standalone home health care. One of the reps this past week wrote 15 of these home care. What Tom is saying is real. And it doesn't really matter how you transact business. These people that we have that are a relationship with in the call center, they don't use Zoom. They don't go out face to face. It's just strictly over the phone. These products can be transacted any of those ways. And my goodness, we're seeing some amazing success that we have with people who are doing it kind of in a way that is not involving all of today's technology, as far as sharing your screen and everything else, or the in-person. And yet the numbers are still amazing as far as the success they're having, because they're just having the conversation.
Perfect. Thanks, Dennis. And you know what? And you guys can do it too. So we're here to help you. Check out our other webinars. Be on the lookout from your marketer. First thing for you to do is, if you're not appointed, start that ship going. Go talk to your marketer and get appointed with these products so you have it available. And we have everything else you need. So it's basically a turnkey operation. So thanks, everybody. This is Tom Randall again with my buddy Dennis Reiner, saying thanks so much for your time.
Thanks, everyone. Have a great rest of your day.
The next step is yours. Contact your marketer for more information and to start offering short-term care solutions to your clients. And be sure to sign up for our other short-term care hot topic webinars.